So, the topic of today, I think we've got a lot of people who are already in. So, the topic of today's webinar is one that has been discussed in a variety of ways throughout the consultations that we've been having for the framework. And this has been, whether as a way to determine goals for the child and family, whether it's to understand the child's abilities during everyday activities and settings, considering the uniqueness of each child and family, and also how we know if what we're doing is being effective. Today, it's wonderful. We've got professionals from all walks and disciplines from around Australia, as well as some international colleagues who are joining us. It's obviously a very popular topic. We've already got over 100 people who have joined. So I have the pleasure of introducing Professor Marisa Macy, coming to us all the way from Wyoming. So thank you, Marisa, where it is still Thursday. So yet to join us on Friday, and there's a lot of snow on the ground, I believe. So a little bit different to here in Australia. So I've had the absolute pleasure to have met Marisa previously and really appreciate her passion for this area and also the field. And thank you very much for agreeing to present for us today on a topic that's obviously there's a lot of strong interest in. So Marisa holds the John P. Elbogen Foundation Professorship of Early Childhood Education at the University of Wyoming. She has more than 25 years of experience as an educator. She received master's and doctorate degrees in special education with early childhood special education and early childhood intervention from the University of Oregon. And Marisa completed the certificate in early education leadership from the Graduate School of Education at Harvard. So the title of today's presentation, which has brought you all here, is Authentic Assessment and Alignment with Professional Practices. So thank you very much for being here, Marisa. It's over to you.
Thank you, Denise, for inviting me. And thank you, Trish and Megan. Also, it is such an honor to be here with you all. And I just want you to know I'm like a rock star in my own family because I'm here with you. My daughter is a huge Bluey fan, and it is so exciting. I'm going to go ahead and pull up my PowerPoint slide to talk with you tonight. Well, it's tonight, Thursday night, Friday morning for you about authentic assessment. So I'm so honored to be here with you, and I'm so excited to talk with you about assessment. So I'm going to start by just kind of giving you a working definition of assessment, and then start talking about authentic assessment. And then I'm going to talk about some standards for authentic assessment. And then I'll wrap up with about 15 minutes at the end where we can do some questions and answers. So assessment, we're talking about assessment today. And I really like this quote by Yuri Bronfenbrenner. He was a professor at Cornell, and he's the one who came up with the ecological systems theory. And he says assessment is the science of examining the strange behaviors of children in strange situations with strange adults for the briefest possible periods of time. And in some ways, that's what we do when we assess children. A lot of times we're looking at items or skills on a test that they might not use in their daily life. But we look at those items for different reasons, but that's a strange thing we do. And then oftentimes the situations are strange for children. They're not part of their like familiar routines and activities that they do. And the adults might be unfamiliar to the child and might be a stranger. And a lot of times we're collecting all this information with not very much time. So we're trying to collect the information. We don't have much time, and we're looking at the child as a person, but we don't really have that much longitudinal data or that much interaction with the child. So that's a strange thing we do when we assess children. And I like to remember that tests do not make decisions, people make decisions. And sometimes the decisions are high stakes decisions that we make with our assessment information that we collect. So, what is assessment? Uh, One of the things that's kind of fun is to look at the root of words. And assessment comes from Latin, and the word is assidere. And assidere in Latin means sit beside and get to know. And I have this picture of a child on a swing, and in some ways, the root word really gives a more authentic way to collect information, sit beside and get to know. Um, and uh, so that's kind of where the word comes from. And so for assessment, there's many different strategies and ways that we can collect information and get to know a person. And one way is through observation. And they say a picture is worth 1,000 words. And when we observe a child, we can learn so many things about them. If you know the singer Bruce Springsteen, he's an American from New Jersey, and one of his songs, he has this line that says, "I will train my eyes to see." And in some ways, that's what we do with authentic assessment. We're training ourselves to see and to observe and to sit beside and get to know. And so, authentic assessment gives us a lens for observing child development and learning. And so, it can be used as a way to gather information and sit beside and get to know. And so, for the lens that we use, we can look at things close up. My daughter recently had a field trip, and her class came over to campus at my university, and we have this big new microscope on campus. It's a humongous microscope, and it really like gets you can see really teeny tiny things. And so we can use a lens for observing children and see things close up and get details. We can also uh, think of our lens for observing and be able to see things that are far away. And so we can learn a lot about a child in their daily environments, and that might include their community and things that are in their home and where they spend their time. So these are just some things that make up an authentic assessment. It is observation based. So we're observing children in their typical everyday environments. Authentic assessment is also developmentally appropriate. So we're looking at skills and behaviors that would be typical for a child of their age and development. It's also collaborative, so we can collaborate with families and parents and siblings, and also an interdisciplinary, multidisciplinary, transdisciplinary team. So professionals can collaborate when collecting authentic assessment information. And so it relies on observations, reports, judgments of familiar and knowledgeable caregivers in a child's life with whom the child has an attachment relationship. So, people who are familiar with the child are able to provide lots of great information. Authentic routines are another great way to collect information about authentic assessment. And these authentic routines could occur during everyday activities and routines. So, one of my favorite routines of the day is dropping my daughter off at school and then picking her up from school. And a lot of great conversations happen between her and I in that kiss and go lane when we're just about to say goodbye. And so that's an example of a routine. And so meal times are great routines, activities that happen every day or on a regular basis. And then it also is helpful across multiple people. So when multiple people are able to observe the child's development and learning and weigh in on what we're seeing, that's a great way to corroborate what we're seeing and what we're finding. And then across multiple settings. So it could be within the child's home, community, school, places where they spend time. So those are some different things to think about with authentic routines. And then we're also capturing the child's strengths, and we're looking at their individual strengths, and we're also documenting and learning about their well-developed competencies. So we're trying to find out where they are now and where they're going to be going with their development and learning. And that was a picture of my daughter when we were still in the hospital after I gave birth to her. The professionals at the hospital were doing a screening for her hearing, and it was a standardized test with equipment that was trying to learn more about her hearing. And back then, if she moved, you'd have to start all over again. And that test, we did it so many times, and we never were able to get a good assessment during the visit or while we were in the hospital. And so we had to go back a week later and do it again. And so that's what that picture is. So, authentic and functional skills are also part of an authentic assessment. We want to look at skills and behaviors that are part of the child's repertoire and that are functional for them and help them be as independent as possible in their environments. So it should be viewed as embedded within the program's instructional and therapeutic goals and activities. We can also consider effective communication as beginning with a nurturing relationship with parents and family members. And so those are some components. And so trusting relationships with families will enhance our collaboration. And when we share our insights and if we write reports, that we want to focus on strengths and use a strengths-based approach and highlight the assets and look for those opportunities to establish rapport with families. So we want to choose authentic assessment measures if we're using different instruments or tools that can help us describe the child's capabilities and also their needs. So all measures can be chosen that are based on the extent to which they enable parents and professionals to plan a child's individualized program of instruction and therapy. So that's what we can focus on with our authentic assessment. Oops, I went way too far. It's like it froze for just a minute. Okay, so if I was to rewrite that quote by Yuri Bronfenbrenner, and instead of saying assessment is, authentic assessment is. The authentic assessment is the process of examining the functional behaviors and skills of children in familiar situations with familiar adults and familiar materials for extended periods of time. So that's just kind of rewriting the quote. So some ways to think about authentic assessment is comparing it to a more conventional or traditional. And the way that it's different is we can take an authentic assessment and create functional goals and objectives from it. And those goals and objectives can be translated into instruction, a curriculum, intervention, and we can use the assessment information for instruction and therapeutic reasons. And so that's one thing that it allows us to do. And then we can also use the authentic assessment to monitor and evaluate our program efficacy. So we can take that information and see how it's making a difference for the child and the family. So those are some benefits of authentic assessment. And so here's a basket of laundry. And so one of the things that we can think about is how could we use these familiar materials to assess a preschooler or a child of a different age? This is something that most families probably have in their home, and these are familiar materials. And then another thing we could think about is what functional skills could we observe with these familiar materials? And so sometimes we don't need fancy bells and whistles. When we do an assessment, we can use the familiar materials that are available to the child that they are used to seeing, that are part of their daily life. And so I invite you to think about how could we use these materials if we were going to do a home visit or an authentic assessment, and then maybe like what are some of the skills that we might be looking for. Uh, so um, so some things that could be part of an authentic assessment could fall into one of these 8 standards. And so the first one is acceptability. Oh, so I'm going to go through these 8 different uh, authentic assessment standards. Just to kind of give you an idea of where these came from, in 2002, I had the wonderful opportunity and luck to meet my mentor, Dr. Stefano Bagnato. And he's a professor at the University of Pittsburgh, and he's done a lot of research on authentic assessment. And I went to a workshop that he put on, and it was at a conference. And I just was so excited about all the neat things he was talking about. But he and I have been working together since the early 2000s related to authentic assessment. And since 2017, we've been working on a project where we're describing these 8 different standards. And so one of them is the first one I'll talk about is acceptability, authenticity, collaboration, evidence-based, multi-factors, sensitivity, universality, and utility. So acceptability is one of the standards that we think about related to authentic assessment. And when we think of authentic assessment measures and or practices, we want it to be acceptable to the families and other familiar caregivers. We want them to find the practices and measures acceptable. And so what that might look like is that the familiar people in the child's life think that the authentic assessment has worthwhile assessment items with skills that parents and professionals would find important. So for example, this might be a skill that parents and familiar caregivers find acceptable. The child brings hands to midline to put food in mouth. So that might be an example of a skill that a child would use in their life. Another standard for authentic assessment is collaboration. And so what this one is looking at is the family and culture-centered practices that support the family and team engagement. So the assessment allows us to collaborate across people, materials, contexts, and so collaboration is one of the pieces. Family and professionals from different fields collaborate with one another to observe children during typical activities and routines. Another standard is authenticity. And authenticity is looking at naturally occurring skills and behaviors during everyday routines and activities. And the skills are observable and functional for the child to navigate their daily life. So that's authenticity. Skills that are meaningful to the child focus on genuine competencies that make a difference for individual child. Like the child gets across the room to retrieve an object of desire, rather than the child walks across the room to retrieve a book. So it's more authentic for that child. Authenticity also refers to the way the assessment is conducted, how the environment, materials, and other contextual cues can help gather meaningful data. And so that's something that could be considered for authentic assessment. Also, evidence and research is another thing that we want to look at with authentic assessment. An evidence base uh, helps us feel confident with the authentic assessment that we're using. So practices and measures that have been field validated and incorporate evidence-based practices and tools that address needs of children from diverse linguistic, disability, cultural, and socioeconomic backgrounds. So that's one of the standards. For example, many conventional tests lack research to show they can accomplish the purpose of their assessment for all children. So one of the examples could be we want to assess a child who maybe we think or there's concern that the child might be on this spectrum disorder. And so when we look at the measures that we use to assess the child, we want to look at and make sure that there are children that have been included in the standardization sample that have also been on the spectrum and are included in that validation. So those are some things we can think about. So research-based and evidence-based measures. Another thing we could think about and consider is multiple factors. And what we mean by this is multiple situations across settings with multiple people, including familiar caregivers, using multiple methods, and multiple time points for ongoing data collection. So looping back to that Uri Bronfenbrenner quote that said assessment is looking at strange behaviors under strange situations with strange people for the briefest possible periods of time. Multi-factors and multiple factors, we would think about collecting information over time and not just a one-time snapshot. That might not give enough information. And so for multi-factors, this is just an example. Different situations can produce different outcomes. So for example, this is a picture of my daughter, and there's my husband's holding her, and it's snowing and snowy day. And so assessing a child outdoors in the snow might generate different results than in their living room of their house. So the context matters. And so that's something we can think about. Another standard for authentic assessment is sensitivity. And so some things that we can consider for sensitivity would be a graduating scoring system. So instead of just a yes, no kind of rating, just using the two yes or no scores, we can use graduated scoring that has more ways to look at subtle changes. So that's something we can consider. We can also look at the hierarchy of skill sequences that are functional items. So the hierarchy can really help us look at how a child is developing and learning and be able to give us skill levels when we're thinking about the child's growth. Also, we want to have enough items to be able to get comprehensive information about the child's learning and growth. So there's different assessments for different purposes, but we want to consider the standard of coverage and coverage of skills and being able to have enough information and data that are both quantitative and also qualitative. And so, for example, measures that have greater item density may be more sensitive because there are increased opportunities to observe the skill. So that's a standard we can consider for authentic assessment sensitivity. Another standard is universality. So assessment items that allow for alternate materials, responses, and or design features that would elicit an individual's functional capabilities can give us good information when we're making decisions and trying to learn as much as we can about the child's growth and development. We also could consider equitable designs that promote universal design concepts that acknowledge differences and can allow for adaptations based on what an individual child may need. So some conventional assessments don't allow adaptations. They're very structured and standardized, and so being able to consider the universality of the measures that we're using and the practices, we might be able to learn more about how the child's growing and developing. For example, with universality, multiple means of being able to show the skill that could include adaptations based on the child's abilities and motivation. So those are some ways that we can consider the universality standard. Another standard for authentic assessment would be utility. And so this is looking at the usefulness of the authentic assessment. We can consider practices and measures that are useful for creating linkages between assessment, curriculum, intervention instruction, and allow observation of changes through monitoring a child's performance over time. So when we use authentic assessment measures, that's one of the benefits of using authentic assessment because we can have treatment validity. The assessment is intended to give us information and give us a way to be able to create interventions, instruction, and the curriculum that we're going to be using to support the child's growth and development. Goals developed by assessor who is unfamiliar to the child may lack usefulness because they do not know the child very well. For example, the information gleaned from the assessment leads to more opportunities to serve the child that are helpful, like data that leads to high quality individualized goals, individualized instruction and intervention, curricular content, and then we can track the child's progress. So that's a consideration for a standard that can be used for authentic assessment. So this is a table that I created just to kind of see different stages in a professional's career. So I teach at a university, and my students are pre-service professionals and also in-service professionals who are already in the field and in the workforce can consider all 8 of these areas of standards for implementing authentic assessment. And Dr. Stefano Bagnato and I and others have been looking at professional development and how we acquire authentic assessment skills. And one of the things that was so interesting in a big study that we did that was about 3 years is a lot of professionals said they didn't learn authentic assessment in their pre-service training. It was later on, once they were hired and were in the workforce and were already serving children and families, that they either learned on the job or through things like this webinar or workshops, but it was later on that they learned it. And so that was really helpful information that we wrote some papers about related to how we can share different ways to assess children. And so that's what this table means. And so, one of the things that I think is always good to remember with our assessment and authentic assessment is uh, these three words from Italian, niente senza gioia. And it translates into English as nothing without joy. And it comes from the Reggio Emilia approach. And I have this poem here from the 100 Languages that was written by Loris Malaguzzi, who was one of the pioneers of the Reggio Emilia approach. And I think when we assess children and we sit beside and get to know them, that to always remember to have fun. And when we're having fun and they're having fun, we can go so far and learn a lot of great things that can support the child and their family and those of us that are working with them on their team. And I have a website that I have a monthly blog and I have podcasts on there. And so if you're interested, it's called Buttercup and it's www.marisamacy.com. And I have things on there related to authentic assessment. Um, and one of my recent guests is a Harvard professor, Dr. Junlei Lee, and he's the developer of an authentic assessment that's called Simple Interactions. And I just love this quote. When he said this, I got goosebumps because I was like, oh my gosh, I wish I would have thought of that beautiful quote. And so what he said was, so Simple Interaction is the name of his authentic assessment tool. And he said, think about the simple interaction tool as me putting on my glasses. I'm a little nearsighted, so sometimes the things I look at seem a little fuzzy. I put on my glasses, voila, it's clear. And so I think that's what an authentic assessment can give us. It can give us clarity. It can give us information that can support children and their families and ourselves, the professionals that are working with our children and families. And so that just kind of, uh, uh, I thought, distilled what an authentic assessment is. It's like putting on glasses. And so, right now, I would love to hear your thoughts. And so, uh, we have some time now. If you have questions, comments, observations.
Thanks, Marissa. Denise here. We have got a question from Justine in the chat, and it's a question in relation to what is known in speech therapy. And I know Asher has done some stuff on dynamic assessment versus sort of the more traditional or conventional, if you like, assessments. So Justine is asking, is the utility standard similar to dynamic assessment that they might hear about in speech therapy?
Yes, thank you for that question. And I am not a speech language pathologist or a speech therapist, so you would know way better than I would. But I think the utility standard is really looking at the usefulness in terms of does the information we collect from the assessment give us information that professionals find useful, that parents would find useful, that can translate into individualized high quality goals for the child. And then that would translate into treatment and interventions and instruction and curriculum that could be used to address the areas that we're working on with the child. I
Thanks.
hope that answered your question.
Thanks. Yeah, thanks, Marissa. We've got another one from Bonnie about can you provide more examples of authentic assessment measures? And I can just reach over and get your book if you want me to give you any. But yeah, is there some examples? I guess Bonnie, correct me if I'm wrong, but maybe you're asking, are there assessments that are available that could be maybe form the basis of an authentic assessment?
Yeah, thank you for that great question. Um, in the 1990s, when I started off as a special educator, I I started off teaching middle school, and my job was in a resource room setting, and so students came to my classroom uh, for uh, supports in the resource room for math, reading, and language arts. And then 2 hours of the day, I had children with that had a life skills curriculum, so they had more needs. And one of the things that I had as part of my job, along with the other two special educators that I worked with, is um, we we had one school psychologist who shared uh, our school with three other schools. So she wasn't at our school very often, and so we had to share the assessment workload. And so during my planning period, I would have students come into my classroom, or we would go to the like a boardroom, and I would do standardized norm reference test. And I used an achievement test, and then our school psychologist did an IQ test. And this was a long time ago, and we would look at the discrepancy between IQ and achievement in order to determine eligibility for special services. And so I had one planning period a day, and so the students would have to be tested during that time. And sometimes it would take a week or 2 weeks to collect all the information, because it had to be done during this 45 minutes. And so sometimes I was taking them out of their academic classes to assess them. And I just thought, boy, this information needs to be really important, because it was a big toll on the child and their family to collect the information and to go through the process. And one of the things that would happen is we would use the information from the traditional conventional tests in order to make a decision. But then we didn't take that information to create an IEP, an individualized program for the child. The information that we collected at that time of eligibility was also never really used in order to create interventions and instruction that were individualized for the child. And we didn't use it to do program evaluation. So it was kind of a dead end assessment. We just used it to answer a yes, no question, and it didn't really lead to treatment validity. And so I thought, well, there's got to be a better way to this whole process. And so that's how I kind of got into learning more about authentic assessment and different ways to learn about the child's skills and abilities and functional repertoire.
That's okay. What I was thinking as you were saying that and looking at Bonnie's question there is, I know that in the linking your linking book assessment, you've given an example definitely of that different what you were trying to gather from that assessment. I'm wondering if we may even be able to provide as part of the resources to this webinar some of the information from the linking book. And I think I know that you're updating it, and because in the book, just to explain to people, you've got assessments like the Hawaii Early Learning Profile, and then it's been rated against each one of those standards for authentic assessment. And I'm wondering if that may be something that the ones that are familiar here, because I know many of them are not familiar, we might be able to provide as a little bit of additional information just for people to consider how the authenticity, I guess, of those assessments has been determined. Two things. Would it be possible for us to maybe give some examples of some of the assessments that you've already determined have got different levels of authenticity, just to demonstrate that to those who are present, and also your thoughts on the routines-based interview and the MISA?
Thank you for those questions. I'll start with the last one. And then I'll go to the other one.
Yep.
Yes, I teach RBI and in the assessment classes that I teach, routines are something that we all have. We all have our routines during the day that help us get through the days, and it's such a great, wonderful opportunity to use routines as the basis of gathering information about the child's development and their growth and learning. And so the MISER is one type of authentic assessment that we can use. Echo maps are another way to gather information about the child and their environment and ways that we can support the child and look at different settings where they spend their time and their days and those routines.
Yep.
And then some examples. Yeah, you mentioned many wonderful examples. So the Hawaii Early Learning Profile is an example of an authentic assessment. We can think about all 8 of those standards, like authenticity, utility, and it can give us information about the child's growth and learning. Those are some different measures. Some of the other ones that we talk about in our book is the Carolina curriculum. That's a great one for children with more severe, profound needs and supports that are needed for the child, because when we looked at the density of items, the Carolina has many, many items, and it breaks skills down into small parts. And so sometimes a lot of parents will say, there wasn't a lot of growth since the last time we met. Maybe 6 months ago we had our family meeting, and not a lot has happened in those 6 months or 3 months or a year. And that can sometimes be punishing for families to not see much growth. But if we can use an authentic assessment that has many items that can show subtle changes, we can show like, these are the things that have happened since the last time that we met, and the measure that has a lot of items we can look at the sensitivity and be able to share with the team and other professionals and the families all of the things that we're learning. Is that what you wanted to know, Denise? Just some titles or examples of different authentic assessment measures?
Yeah, I think so. And there's just been a little bit in the chat about the linking book. So we'll put that in as a reference as well. And, so people, and I know that there's a new edition of that coming up. So I think that will give people really good information about, looking at those standards and comparing it probably even to any assessment that they have access to. But you've already done a lot of the work in that way. We've just got a couple of other questions, if you're happy. Marisa, there's ones, this is involved in the early childhood education area. Ivy has asked, Since time and resources are often limited in early childhood education, what do you recommend as efficient ways to implement authentic assessment without overwhelming families or the facility?
Oh, that is a great question. Thank you, Ivy. Yes, so I think one way to use resources in a way that can go far is collaboration. I think sometimes we think, well, if we're the assessor, it all rests on our shoulders to collect all of the information and do the assessment. But I think collaborating with the families and parents and siblings and other professionals that the family might be working with is a great way to utilize resources. Also, sharing resources within the program or the agency and learning from others that are using authentic assessment, how they go about collecting information and sharing ideas with one another. One of the things that I started talking about was developmentally appropriate practice, and using an authentic assessment can support developmentally appropriate practice and being able to see the child's development and where they're at individually, and then be able to watch them over time as they grow and change and develop. Thank you, Ivy, for that great question.
Thanks, Marisa. Look, I'll this is just going back to the dynamic assessment. Justine's just added a little bit more information and is just asking for some clarity. So in dynamic assessment, they focus on the child's potential to learn and change by providing targeted teaching and then reassessing their abilities. Does this happen in authentic assessment?
Yes, I think it does happen in authentic assessment. So a dynamic assessment looks at potential, and I think one of the things that is really helpful with assessing children is being able to have a good understanding of typical and atypical development. And I think the potential to learn and change comes into play when we think about the child 3 months from now, 6 months from now, 12 months from now. And uh, here in America, we create individualized education plans. Is that what you do in Australia also, Denise?
Yep, there are. Yep.
And when we create those here, we have a law that says every year we have to create a new one. So it has a timeline. It's good for 1 year. And one of the things we're required to do by law is do progress reports and inform the family and the parents how the child's doing. And so one of the things with potential to learn is being able to have a good understanding of what is typical milestones, what would come next in a sequence or a typical pattern, and being able to kind of think down the road 3 months from now, 6 months from now, a year from now, and be able to aim for those. And so the assessment tool can help us with that, and just our understanding of the development, typical developmental milestones. And then each child will grow and develop at their own rate. And so being able to observe the child and monitor how they're responding to the interventions or instruction or curriculum that we're using, and collecting ongoing information can give us an idea of that potential, and be able to help with the next steps.
Thanks, Marisa. I can see there's a question from Claire, and maybe we could include it again as information from the webinar. She's wondering if you had any recommended reading on the Reggio Emilia approach, a good 101. So maybe we could, look at sharing that as part of the resources. And I think the rest of your question, Claire, about pre-existing checklists that think would be good components. So I think we may have covered that part of the question. Kelsey has asked, in the early childhood education space, how could we use routine documentation of skills as a way to engage in authentic assessment with that documentation without having a guided assessment tool? How could we identify areas of concern from this routine documentation?
Oh, I love that question. That was Claire who asked that one?
It was Kelsey.
Kelsey. Oh my gosh, Kelsey, I love that question. So, documentation is a way to record and capture what we're seeing and what we're learning. And the documentation can be used internally by our professional team, and we can keep it for our own. We can also share that documentation with the families and the parents. We can also share the documentation with our community and have different ways within our program to share what children are learning. But the documentation is a way to capture. And that's kind of what we're doing when we're observing and assessing children, is uh, we're trying to capture that time and be able to understand as much as we can, and be able to look for patterns and interpret what we're seeing.
Can we adhere to the standards? This is from Lorna. Can we adhere to the standards with thorough observation alone rather than using checklists or tool, providing the observer has sound child development knowledge? So I guess the question is, can you use thorough observation alone?
Oh, that is a great question. That was Morna.
That was Lorna. Yeah.
Lorna. Thank you, Lorna. Uh, that one, I think, depends on so many factors. We have different program guidelines and requirements that might need to be fulfilled. So I think it would depend on so many different things. It's also something to consider the purpose of the assessment, because there might be different requirements depending on the purpose. So we could do authentic assessment for screening. We could assess and use authentic assessment to determine eligibility for services. We could use authentic assessment to do progress monitoring and observe how the child is changing and responding to the program, the curriculum, the individualized instruction. And so we might have different requirements for different purposes also. So it's hard to answer that one because it depends.
Thanks, Marisa. Hopefully, though, that's given some information there about what you're thinking about and the different purposes for assessment there but I guess what you've highlighted is you can use authentic assessment across all of those areas.
Yes.
Sam's asked a question, and I think we sort of talked about it a little bit before the webinar started. And this is really that interface between authentic assessment and what standardized assessments early childhood professionals may use a lot, but how they actually link in, how we can use both standardized developmental checklists and authentic assessment together, I guess, to effectively build that picture of the child. So she would specifically love to understand how we support our professionals when a standardized assessment would be useful to inform an authentic assessment, and how both can work in tandem to provide a comprehensive understanding.
Yes, they can work in tandem. And I think it doesn't have to be either or. Uh, uh, for example, some places might require a standardized norm referenced conventional traditional assessment. at the time of eligibility. And we can use an authentic assessment to corroborate the findings that we get from a conventional assessment. And then what that corroboration allows us to do is we can be able to take the information that we gain initially to create goals and objectives for the child that are individualized, and be able to monitor how they're responding to the intervention and instruction based on that information. So I think that's a great question, and a really good point that she's making also, that we can use them together, and the information can be used to link different components of the child's program.
Yep. Thanks, Marissa. And look, we're 2 minutes over time, in fact. So thank you. Thank you very much for giving that time for the conversation at the end. I think that was really important to be able to answer a lot of the questions that are probably more nuanced than you might be able to provide in a presentation. So thank you very much for your presentation. I think it's certainly got given us a lot to think about as to how we continue looking at authentic assessment in the early childhood intervention field here in Australia. So thank you very much for your time.
Well, thank you, everybody. Thank you, Denise. Thank you, Megan. Thank you, Trish, and all of you for having me. This is my campus right now. It's snowing, and I just it's been such a delight to get to talk with you and learn more about Australia. And if you have any questions, please reach out to me. My email address is mmacy2, the number 2, at uwyo.edu.
Thank you, everybody, for attending, and we will get this uploaded as soon as possible onto the Precy website for you. Thank you.